Good morning, everyone. Welcome to the first ever virtual Champions for Young Children Symposium. We're so glad that you chose to join us today. I just want to introduce Erin Barton. She's with Vanderbilt University, and she will be talking about supporting children's social emotional competence and preventing challenging behaviors. Just a couple of housekeeping notes as we start. There are two options for interaction. One is to use the chat, and we'll use the chat just for comments and things that you might need to know about the platform. And then we'll use the Q&A box for you to ask questions about the session. Those things will be monitored, and we'll make sure that Erin knows what questions you have. The handouts for this session, there will be a link posted in the chat for you to access handouts from this session. Also, there's a link in the chat if you would like to watch the closed captions on a separate screen. You can view the live transcript by clicking on that. As a reminder, if you signed up to receive Child Care Training Credit or CEUs, you must view this live session in its entirety via Zoom webinar, which is where you are now. If you have any questions, please reach out to scic@mailbox.sc.edu, and we can put that email address in the chat as well. So I think that is our announcements, and so I'll let Erin get started with the reason why you're all here.
Thank you, Heather. So today, as Heather said, I'm going to talk about how to support children's social emotional competence and how to prevent challenging behaviors and decrease challenging behaviors. What I'm presenting today is a little bit different from maybe what I've done in the past. And the reason is because within my lab, within my research lab at Vanderbilt, my students and I, my team, have spent this time during quarantine creating lots of new resources for parents, for caregivers, for childcare providers, and for teachers to use to support families during this time. So everything that I'm presenting today is free and available and accessible through my website and also through social media, my social media sites, which I will share as well. So this is a screenshot of the website, and the website is listed down there at the bottom. I will share this again with you at the end of the presentation. There are three different categories of resources. Today I'm really going to focus on the first category, which are resources that outline strategies for supporting children's social emotional competence and preventing challenging behaviors. On my website, I also have several resources that we've created recently related to supporting children's play at home and in the classroom. And then our newest category of resources are resources that support inclusion, diversity, acceptance, and equity. And so we have some new exciting resources there as well that that again are free. You're very much encouraged to download, share, and you can even adapt them and make them your own, make them appropriate for your own children or your program or your classroom. Okay, so I will get started. As I said, what we're going to focus on today is really supporting children's social emotional competence and preventing challenging behaviors. And I'm starting with this handout, this infographic that we created that we call Stay Calm, Connect, and Reflect. And the reason why I'm starting with this is because one of the things we know about young children is that they're going to engage in challenging behaviors. Children just got here, they're just learning how to be social, they're just learning how to communicate. And one thing we know about social and communication skills is that they are complex and they're difficult and they are different across contexts. We also know that right now times are different and routines are different and things are in many ways more difficult for children and families. And so there are going to be some challenging behaviors. And what's really important as an adult to do when children engage in challenging behaviors is to check in with yourself and to acknowledge that it's stressful and that you might have some feelings about your child's challenging behavior. And so we talk about staying calm. So remember, one great thing that's helpful to do when children engage in challenging behaviors is to remember something you love about the child. Count to 10 slowly, take some deep breaths, repeat a positive affirmation, and then while the challenging behavior is happening, you don't want to give too much attention to the child, but one thing you might calmly do, as long as you're calm, is to label and acknowledge the child's feelings, reassure your child and show affection, and look for opportunities to celebrate your child's challenging behavior. Sorry. I don't, sweetie. I'm doing a webinar right now. Okay. Sorry about that. Then the other thing that's important for you to do is to reflect on what happened during the challenging behavior. What might the child have been feeling? What was your child's behavior communicating? And how might you respond if this behavior happens again? And so we created this handout, and we like to share it at the beginning of all of our presentations related to challenging behaviors, because we understand how stressful they can be. We understand that that children are going to engage in challenging behaviors during this time. And so it's really important for adults to check in with themselves, stay calm, connect, and reflect. And this can be critically important for making sure that you can support your child and support their social emotional competence and make sure that challenging behaviors decrease over time. It's also a really great way to model strategies and ways to cope with times of frustration. So talking through that you're frustrated, counting to 10, modeling counting to 10, modeling taking deep breaths, modeling how you're reflecting on what happened can be great strategies as well to show the child what you do when you get frustrated. And so, and as I said, I'm just going to remind you one more time that all of these handouts, all of these infographics are free and available for you to download, print, share, really do whatever you want with them. So then the next handout that I want to share is related to nurturing positive family and professional partnerships. So we know right now in some places, if not already, then soon, and in many cases already, children are re-engaging in either classrooms or going back to childcare programs or doing virtual learning. And so the other thing that's really important, and really one of the most important things to remember during this time, is that relationships are still central to everything we do. And so it's really important to remember, as either a childcare provider, a family, a parent, a caregiver, a teacher, that taking some time during this time when things are changing and we're trying to figure out virtual learning, or we're trying to figure out what it means to be back in a classroom, or what it means to be at home all the time, that we need to focus on the relationship between families and professionals. And so we created this infographic that really outlines strategies for maintaining positive family and professional partnerships. And remember that this is key and this is central. And it might be a little bit different these days. It might be a lot different. And it might be more difficult. But one central thing to remember is that families are essential team members. We have some tips here for professionals to do. Really talk about child's accomplishments, ask the family how they prefer to be contacted, share resources, and then also remember to be responsive and patient, because families are trying to do a lot right now, more than perhaps we've ever been expected to do before. Again, communication is key. Making sure that you have figured out good strategies for communicating amongst the families and professionals. And then we have some tips for families here as well. Okay, so this next handout, I love this handout, and we've gotten lots of great feedback on this one too, is to focus on trying to keep it positive. And, you know, I understand that there are times where it's difficult and you're frustrated, and that's when, you know, we need to go back to keep calm, reflect, and connect. Um, and also, one strategy that we can use is to try to keep it positive. So when children are engaging in challenging behavior, a common thing that we always do, that I sometimes find myself doing, is to say, don't do that, or stop, because it's kind of our reaction, right? We want you to stop doing that. But what we know that the children hears is something negative, right? So these statements can lead to a cycle of frustration and challenging behavior. And so we encourage you to think about reframing these into positive statements that really explicitly tell the child what the expectations are. And so it outlines exactly what the expectations are for the child, which can really be helpful for the child. So the child knows what you want them to do rather than what you want them not to do. We know that this might be central to supporting your relationship with the child, rather than always focusing on what they shouldn't do, really focusing on what they're doing really great and what you want them to do. So we created this handout that kind of goes through what you say, and then what your child hears, and then what you said before, and what you can say instead. So this last panel walks through some things you can do and you can say instead of maybe what not to do, to support your child's challenging behavior, to support your child's social emotional competence and reduce challenging behavior. So always, when challenging behavior is happening, it's always best to not engage the child too much, and to try to avoid attending to the challenging behavior, of course, while making sure the child's safe, and maybe calmly and clearly stating what the expectation is. So there are some great examples here, like remember walking feet in the house, or try doing this instead and showing them, or reminding them you can ask your brother for a turn. Or a great thing to do is to acknowledge their feelings. I see you're really frustrated. Do you want to keep playing, or do you want me to help you take a break? Another option would be to give them a simple choice related to what they're doing. Do you want to do the train now, or do you want to play with the blocks? Do you want to go outside now, or do you want to stay inside and keep playing with the blocks? And so this handout can be really helpful for thinking about kind of what you're currently doing in responding to the challenging behavior, and then how you might respond in a different way in the future. Then this handout is about your hot buttons. And hot buttons are things that might, you know, push your buttons, might get you a little bit more frustrated than other things. And we all have them. They're usually kind of individualized, idiosyncratic. Of course, there's probably some common ones. But what's important to remember, and what we like to really emphasize, is that children have hot buttons too. And so we have hot buttons. Like for me, a hot button is definitely when I have to repeat, you know, put your shoes on 35 times before we can leave the house in the morning. Not that we're leaving the house that often these days, but that is a hot button for me. I also don't like it when other adults are screaming and yelling. That's definitely a hot button for me. Another hot button for me is when we have a planned activity, but it has to change a little bit. I usually get frustrated there. And so it's important for me to identify what those hot buttons are, or when I'm starting to get frustrated or stressed related to something that's kind of out of my control, and then reflect and try to manage those feelings so that I don't take them out on my child. It's important to remember that children have hot buttons too. Sometimes I know for my 6-year-old, when I tell him he can't do something or have something, he often has a reaction to that, and not a great reaction. He also doesn't like it when routines are disrupted. And he also doesn't love, like many kids, doing something that he doesn't want to do, like going to bed on time, or taking a shower when he's, you know, otherwise engaged in a preferred activity. during the bedtime routine. So it's really important to think about what your child's hot buttons might be, and also what your hot buttons are. And so we have over here on the left, the first page of this infographic is really about some examples about hot buttons. And then the next one is about how to support your child when you know that there's a hot button that your child might be experiencing, how to connect and reflect on that, and then how to reframe your hot buttons. So rather than reacting, but to really think through and reflect on what's happening in the situation, to reframe your hot buttons so that you can stay calm. And also, I also want to say though that these are perfectly normal. So it's perfectly normal to be frustrated, to have feelings of frustration, and to have feelings of, you know, that it's difficult. But what we want to make sure you do is you model strategies for managing and coping with those feelings in ways that are effective rather than destructive. Okay. So now, so I've talked about kind of some universal things that we can do. We talked about staying calm and reflecting and connecting when challenging behaviors happen, because we know challenging behaviors are going to happen. Children, as I said, children are learning how to be social. They're learning how to communicate. And so they're going to occasionally engage in challenging behaviors. And during these times where, you know, things are different, things are changing, things are different than they've ever been before, we might expect children to engage in more challenging behavior. And we also might expect our patients to be a little more thin, and us to have fewer reserves available to cope when things are frustrating or difficult. And so it's important to be able to understand that those things are normal and typical, and that, you know, a great strategy for working through them is to do that. I'll just flip back to this one: stay calm, connect, and reflect. And then we talked about relationships, and relationships are key and continue to be key. We talked about keeping it positive when challenging behaviors occur, recognizing hot buttons. So now, for the rest of the our time together, I'm going to go over 3 categories of practices that can support children's social emotional competence and reduce challenging behavior. The first thing I'm going to talk about, the first category of practices are prevention practices. So these are prevent strategies. So these prevent strategies are things you can do all day long, whether you're at home, in the classroom, outside, inside, at the grocery store, in the car. So these are prevent strategies that can happen all day long, and they prevent the challenging behavior from happening. Of course, sometimes the challenging behavior is still going to happen, but they make the challenging behavior less likely to occur. And then, so I'm going to go over prevent strategies, and then I'm going to go over some strategies, because remember, children are young, they're just learning how to be communicative, they're just learning how to use language, they're just learning how to be social. Those are all very complex skills, and so I'm going to go over some strategies for teaching children how to communicate instead of using challenging behaviors. And then the last category of practices that I'm going to review are new responses to the challenging behavior. So what to do instead of maybe attending to the challenging behaviors. So I'm going to go over some ways to respond to challenging behaviors that make challenging behaviors less likely to occur. Okay, so the first, as I said, the first category that I'm going to review are prevent strategies, and prevent strategies make the challenging behaviors less likely to occur. And the first one, and perhaps the most important, especially now as routines are changing, are to make sure children know what the expectations are, right? You know, Heather at the beginning of this talk went over some housekeeping things. That's essentially reviewing behavior expectations, right? So it's really important for us to recognize that children need to know what we want them to do. They want to know what they're supposed to be doing. And so setting clear expectations for, either, you know, the next hour, or, you know, what virtual learning is going to look like at home, or what it means to return to the classroom, or what you should do when mom's doing a webinar and you can't find the iPad. Making sure that we set really clear behavior expectations for children so that they understand what the expectations are. Makes it more likely that they're going to do what we expect them to do, and makes challenge behaviors less likely. So we walk through the steps for setting clear behavior expectations here. The first one is to clearly state what they are. So kind of go back to that, state it positively. So instead of saying no running certainly tells the child what you don't want them to do, but it doesn't tell them, you know, how to get to the next room, right? It tells them you don't want them to run, but it doesn't tell them what you want them to do. So instead, you know, saying using walking feet. Visuals can be really helpful, and visuals don't need to be like board maker or printed, or, you know, like an infographic like we've created. They can just be, you know, on a scratch piece of paper. You can just write out what the expectations are. Do a quick drawing. I mean, children, visuals can be really helpful for making sure children understand what you want them to do. Visuals are also a really great reminder for adults to remind yourself what you, your expectations were for the child. Reviewing the expectations, and maybe providing some examples. So remember, you know, when, you know, the timer goes off, it's going to be time to clean up your blocks. And that means that I want you to put all the blocks back in the bin. And so providing examples and non-examples of what you expect. So you know, we need to make sure we clean up all the blocks. We don't want any left on the floor, so that we don't trip on them. So making sure children know exactly what the expectations are. Give your child lots of opportunities to model and practice. Understand that they might not know how to do it the first time. They might not understand the expectations the first time. And then give lots and lots of what we call PDF, which is positive descriptive feedback, to let your child know that what they did was awesome. So on the website, this is a quick picture of an infographic related to creating a visual schedule. We have lots of examples of these on our website and on our social media sites. You are welcome to use these, adapt them any way you want, print them out, you know, use them in your home, your program, share them. They are for you all to use in any way that's helpful. I have found visuals to be extremely helpful for us, my family, during this time, because they also allow my husband and I, and we have a babysitter who's here sometimes, I don't have to necessarily explain to them what the schedules should look like or what the expectations are, because I've created a visual schedule that outlines what the day's going to look like. So they're a great way too for adults to be consistent. And they really help children understand what the routine's going to look like. And they help children know that the routine's predictable and that they know what to expect next. And children learn best when there's a predictable routine. Predictable routines give the child a sense of safety, because they know what they should expect, and also what's going to happen and what their expectations are. And so it helps them, it reduces challenging behavior, and it helps support their learning and development throughout the day. This one is one of my favorites. This was one of the first ones we did. And so this is a really important prevent strategy. I know you're all doing this one already, and it's just a great reminder to keep doing this one all the time. So I talked about PDF, positive descriptive feedback, which is great, and, you know, should be used pretty liberally to let children know what that, you know, they're doing what we want them to do. Positive or frequent positive attention is even easier, because it's simply just attention to your child. It's simply just, you know, taking a minute to give your child a thumbs up, or taking a minute to pat your child on the back. And it doesn't have to be contingent on, and it doesn't have to be related to any behavior. They could just be, you know, playing nicely on the floor, or they could be, you know, just walking into the next room. And you could just, you know, reach over and give them a hug, or just a big smile. So it's just things that tell the child that you love them and you think they're, you know, the coolest little kid on the earth. And that's really important for children to hear all the time. And it's important too for you to support your relationship with your child. And this also works in the classroom. So children in classrooms need to have this from caregivers in the classroom as well. And this should happen all day long. Children should get this from multiple adults all day long. And I know often children do. We are talking about it a lot now because when things are different, when things are changing, and when things are more difficult, it might be even more important to give more of this. So positive attention also is, you know, related to play. You could just sit down and play with your child for a couple minutes. And, you know, I know firsthand that sitting down, whether you're in a classroom or at home, sitting down and playing with your child for a couple minutes goes a long way. You don't have to stay there, you know, for the whole time your child's playing, but just even a couple minutes can be super exciting for your child. And so it's, again, like I said, it's not necessarily dependent on anything that your child's doing. It could be just hugging. It could be, you know, like I said, a thumbs up, a big smile. You might pair it with positive descriptive feedback. Now, positive descriptive feedback is related to what the child's doing. So it's saying things like, wow, look at the tower you built, or wow, you brush your teeth so fast, or you got your shoes on and I only told you one time. You're such a good listener. So positive descriptive feedback is about what the child's doing versus, and also can be used, you know, throughout the day. Frequent positive attention doesn't have to have anything to do with what the child's doing. I would not give this when the child's engaged in challenging behavior, but it can be, you know, like I said, when the child's just simply, you know, walk into the next room and you give them a big smile just to show them that you love them. So as I said, a great way to give your child positive attention can be just playing with your child. And so there are some ways, and I know that things, you know, I know we're working and, you know, we're trying to do virtual school. So I'm not saying that you have to spend, you know, an hour, even 20 minutes, you know, this can be just 5 minutes a day where you're, and it could be in the bath time. It could be, you know, while you're, you know, waiting, while you're, you know, cleaning up toys, or while you're getting dressed. You can embed playtime into routines as well. There are some good ways to play with your child that can really support your relationship with the child. And a great way to play with your child is to really follow their lead during play rather than direct their play. And so we have kind of 3 things that we emphasize that you might do when you're playing with your child. The first one is to say what they say and do what they do. A fancy word for this, a fancy term for this, 2 words, is contingent imitation. But all it means is that you are playing with your child and you're doing what they're doing. So you're imitating what they're doing and you're talking about what they, and you're saying what they're saying. And that can be, even when it's like really ridiculous and silly, imitating your child, what they're doing and saying, can really get your child's attention and can show them that you're interested in what they're doing. And then another thing you can do is just describe what they're doing. You can, you know, you're tapping the drum, or, wow, you know, your car's fast, or that tower's so high, or you're feeding the baby. And that can help you to follow your child's lead in play. And then once you've done that, once you've like imitated a little bit of their play, talked about what they're doing, then you might build off of what they're doing. So we don't want you to spend a lot of time while you're playing with your child trying to get them to do something else, because playtime should really be about building that relationship and supporting the child and following their lead. But you can expand on what they're doing. So like if your child, this is a great example here, if your child is playing with cars and says car, you can add words to it. It's a fast car or red car. Or if the child's, building a tower, you might expand the tower a little bit out horizontally rather than vertically. Or if your child's playing with a baby and feeding the baby, you might say, wow, your baby's hungry, time to burp the baby. And so you're adding one thing to what the child's doing in play without being too directive, because that can, well, quite honestly, can make the child not want to play with you very often if you're only telling them what to do during play. And then this is positive descriptive feedback. This is a strategy for using that. You provide positive attention, and you state exactly what it is that the child did that was great. Now, one thing to avoid is lots of good job, putting your shoes on, or good job cleaning up the toys, or good job eating your dinner. That can sound a little saccharine and not genuine. And so you want to make sure that you use different types of statements. And you might think about, praising effort rather than the accomplishment all the time. So like, you're working really hard to put your shoes on. Wow, I'm proud of you. You're going to figure out how to tie your shoes soon. Or you brushed your teeth so fast. Or you brushed all your teeth, look at how clean your teeth are, rather than just lots of good jobs, can be more exciting for you and certainly more meaningful for the child. Transition warnings. So this is a really important prevent strategy. There might be lots of different transitions. There might be fewer transitions these days than before. But it's always helpful to provide a warning. These days too, between phones or, Alexa or Google, we have all sorts of technologies that might. I'm not sure about that. Alexa heard me. There are all sorts of technologies that we can use to provide transition warnings. So, and I have found with my child, my 6-year-old, it's helpful for him to help me set timers. So when I know, related to bedtime or a more difficult transition or task, sometimes when I let him help me pick which timer we're going to use or which sound it's going to make, or I let him talk to the thing over in the corner whose name I'm not going to say right now, I let him set the timer in that transition. That can be really helpful. We also have, we use that thing over in the corner to every day at the same time, she says, it's bedtime, Joseph, time to go to bed. And so it kind of removes it from us. So, and it's every day at the same time so that he knows that it's bedtime. So we're going to start the bedtime routine. And it's helpful because he knows what to expect. It's always the same time. I have cheated and made it earlier some days, but he doesn't know that. It removes it from me. So it's like and it's still not seamless and it's not always going to be perfect. But it has been really helpful for removing frustrations related to the bedtime routine. Another great prevent strategy is to add more choices and to provide choices. So providing choices between activities are great, and this infographic walks through some steps for doing that. So you might identify a time when you can add choices, provide choices prior to when challenging behaviors have been likely to occur. And then when you're first starting with younger children, you probably just want to use 2 choices, and then over time you can maybe provide more. If children are really young, like toddlers, you're going to have to maybe help them make choices. And sometimes children, when they're first learning how to make a choice, they make a choice and then they realize they didn't want that choice. And so you want to make sure that you kind of follow through on the choice so that they learn how to make a choice. And then you might give them another choice really quickly after. because you certainly want to support them in learning how to make choices. You can also give lots of choices within activities. Giving children opportunities to communicate what they want within an activity through choices can be a really great way to prevent challenging behaviors as well. And this handout goes through some great strategies for doing that. Okay, so those were prevent strategies. So we went over several different strategies for preventing challenging behaviors. Let's see, we started with setting behavior expectations. Visuals are great. Positive attention throughout the day, playing with your child, positive descriptive feedback, providing transition warnings, and then choices. So those are all strategies for preventing challenging behavior. And like I said, those can be used all day long across settings, in classrooms, in the hallway, on the playground, in your backyard, during meal times, across routines, and really should be used all day long to support your child and to help your child know what to expect and to make sure that your child knows that you love them, and to make sure that your child knows when they're doing something that you want them to do. We also know, though, that prevent strategies are not always going to teach children new skills. And so, especially for children who have some more challenging behavior, maybe some persistent challenging behavior, we want to make sure that we are teaching them how to effectively communicate. So, and we want to teach them how to communicate in a way that's more appropriate than their challenging behavior. Because sometimes their challenging behavior can be really effective, right? Children use challenging behaviors because they work, and sometimes they work repeatedly. And so we want to make sure that we teach children a different strategy, a different way of communicating that's more effective than the challenging behavior. Okay, so the first one is to ask for help. So sometimes children engage in challenging behavior when they're frustrated, when they can't do something during a difficult task, or when something's new. And so this strategy walks through how to teach your child to ask for help. And so you might identify a task, create some opportunities, prompt them, like model for them before they get too frustrated, so that you can make sure that you have an opportunity to teach them a skill before the challenging behavior happens. The child might start to get frustrated, and you might see that, and you might step in and say, you look frustrated. Can I help you? Or do you want to ask for help? Or you can say, help, please, mommy, and then immediately help them. This handout walks through the different types of prompts you might use too. So when teaching children new skills, you might use a gesture prompt, a model prompt. You might gently guide the child to perform the task. Sometimes you might need full physical assistance, where you have complete hand-over-hand assistance, helping the child complete the task. You want to make sure that whatever prompt you use for the child is something that the child's responding to. Some children are not really imitative yet, and so a model prompt might not work. Gentle guidance might be more effective. Some children will completely resist full physical prompting, and so you'll want to avoid that. Another strategy is to request, so for instance, if the child's doing something, but they want to be all done, like taking a bath or mealtime, instead of just getting up and leaving, or instead of engaging in challenging behavior because they're all done, you might teach them to say, I'm all done. I want to get out of the bathtub, or, I want to go back inside, or I'm all done playing with blocks. I want to go outside. And so you will identify situations throughout the day when this might be something that you want to teach your child, and then give them opportunities to do it, and make sure that you use whatever prompts work. So you might model it, you might use a verbal prompt, you might even use some visuals here, and help your child tell you that they want to be all done. Another really important social skill that we have to teach children is how to ask for a turn, right? Especially these days. and when we're all home, but also in the classroom, right? This is not anything new to child care providers or teachers. And so what's important is that we set up opportunities throughout the day to teach children to ask for a turn before challenging behavior happens. Because if we wait until the challenging behavior happens, then we lose the opportunity to really teach it. Another great strategy is to teach the child how to engage in independent play. So yes, spending some of the day, even just brief times playing with your child is a great way to prevent challenging behaviors, to give your child lots and lots of positive attention. And also teaching your child how to independently play is just, for practical reasons, really important, and also for the child's learning and development can be really important. It's not to say social play isn't critically important, and children learn all sorts of social and language skills during play, but making sure that your child can independently engage in the environment in meaningful ways can be really helpful for us when we're home, right? Trying to work. And this is, for many children, something that we need to teach. It's not necessarily something that children just do. We might need to teach this. And so this infographic walks through strategies for teaching it. And it can be, it can take some time, and sometimes, children might play alone for just a few minutes, but gradually they learn to play alone independently for more and more time, for longer durations. Okay, so I'm going to switch over and talk about new responses to challenging behaviors in a second, but before I do that, I want to walk through this handout, which, so again, we've talked about prevent strategies, we've talked about new skills to teach, and I just went over a few teach strategies, just, for the sake of time. There are many additional infographics and many additional skills related to teaching children new skills to replace challenging behaviors that you can find on our website and on our social media sites. And all the same infographics are across both, so you don't have to go to multiple sites. But what I want to outline is that the prevent strategies and the new skills and the new responses, they're all related to what's happening for the child. So when you think about the child's challenging behavior, if you have a child who has persistent challenging behavior throughout the day, you want to think about what we call the ABCs. And so the A's are the antecedents, or what happens right before, and sometimes we say those turn on the challenging behavior. They certainly can make the challenging behavior more likely to occur. And then we think about what's the behavior. So what is the challenging behavior and what it looks like? And then we think about what's the consequence, or what happens right after the challenging behavior. And what is currently happening right after, if the challenge behavior is persistent, is likely something that is working for the child, right? So it's something that might turn the challenging behavior off, but in a way that makes the challenging behavior more likely to keep happening because it's working. So if a child has persistent challenging behavior, thinking about what the A's, the B's, and the C's are can be really important for picking prevent, teach, and new response strategies. So if you think about what turns the behavior on, thinking about that might help you pick which prevent strategies might make it less likely to occur. So does your child always have a tantrum when it's bedtime? Well, maybe let's use some transition warnings. Let's set some timers. Let's create a visual. Let's give the child lots of positive attention, right before bedtime has to occur. Or does the child engage in lots of challenging behavior when you are doing a webinar, or when you are otherwise engaged in work, or when you are working with a sibling, or when you are across the classroom on the other side of the classroom? That might tell you that the challenge behavior is related to adult attention and wanting more adult attention. So you might make sure that you give the child more positive attention during that time. And then thinking about what the behavior is. And so that will help you think about what new skills you need to teach the child. And sometimes it's not a new skill that you need to teach the child. Sometimes it's you need to teach the child when to use a skill they already have. So maybe the child knows perfectly well how to ask for help, but hasn't yet learned how to ask for help, you know, during snack time, or doesn't really understand that they can ask for help when they're cleaning up their toys. And so making sure that you have thought about what the challenging behavior is will help you think about what are the skills I have to teach the child, or what are the skills I have to support the child in using during that time. And then new responses are ways that are things that you do after the challenging behavior happens that might not make the challenging behavior go away right away, but it teaches the child that the challenging behavior is not working. So if the child's engaging in challenging behavior to get your attention, for instance, because you're playing with a sibling, or you're cleaning up on the other side of the classroom, or you're talking to another teacher, or you're talking to, you know, your partner, then you don't want to give them attention for that challenging behavior. But once they calm down, you might teach them ways to get your attention. And we have lots of infographics on how to teach children to appropriately get adult attention on our website. If the child's engaged in challenging behavior, you know, transitioning to new routines, you don't want them to necessarily get out of that routine. So they shouldn't really be able to avoid that routine, but you will support them in following through on that routine or completing that task, and then give them lots of opportunities throughout the day to be able to request when they want to delay something, or when they want to take a break, or when they want something to be all done. And also use lots of transition warnings, lots of visuals, and lots of reminders of behavior expectations, so they know what the expectations are, and that sometimes, even though it's difficult and even though they don't like it, they still have to do it. So this is a new response strategy, a really important one, and this is avoid attending to the behavior. So of course, make sure the child's safe, make sure everybody's safe, but don't give the child lots of additional attention for the challenge behavior, because you don't want the challenge behavior to necessarily work for the child. You might provide one verbal reminder. So if you see the challenging behavior about to start, you might just give one reminder, like avoid telling them no, like avoid negative attention, like stop crying, or I wouldn't say stop crying, or you know, don't have a tantrum, but you can give them one reminder about what they would do, so that you minimize attention, but also support them in knowing an appropriate way. So a great thing to say is, remember, you can say all done, or it's bedtime, remember, she told us it's bedtime. We can go to bed and read, you know, you can pick 2 books to read at bedtime. So you are reminding them what the expectation is. A new response might be to delay transitioning to an activity. So you might, your child might engage in challenging behavior to gain access to a preferred activity. So you might delay it for a little bit until, if they engage in challenging behavior. You'll always want to follow through with prompts. And so we have some strategies here for making sure that even when the child's engaged in challenging behavior, that you support a follow through of whatever the task is. And then this one is really important. So again, you don't want to give the child too much attention when the child's engaged in challenging behavior, but make sure that you're providing help once the child is calm. Because it can be hard to calm down when you're upset, right? And so making sure that you give the child lots of support and help once they calm down can be really important for the child. So those were some examples of new response strategies. Like I said, there are some more on our website that I encourage you to look at. We also created 2 handouts, 2 infographics, one on self-care, so taking care of yourself. So this goes through some strategies for supporting your heart, your mind, and your body. And then we also have one that walks through some strategies for really maintaining that partnership, that relationship with the family when we're engaged in distance learning, which many of us are these days. This is our Instagram. So as I said, I showed you the website at the beginning. You can go there and get everything. We also have lots and lots of information on our Instagram. So if you want to follow us on Instagram, this is where we're at Barton Lab. If you search for Barton Lab, you will get our lab. You will also get lots of Barton Labrador retrievers. There's apparently a breeder, which is kind of cool because I like dogs, but that's not us. We are the Barton Lab. And then this is Facebook, which is the Barton Lab on Facebook. This is our page. We have lots of resources there as well. And of course, on the social media, we have more, we're sharing other things too, not just our own things. But on the website, it's just the things that we created. So I guess, are there any questions? Okay, I have 2 questions. Okay, the first question I'm super excited about. Do we have these infographics in Spanish? No, not yet, but we are working on it. We are going to we have some in the works, but we are going to start making them we're going to start translating them into Spanish. It's taken a little bit longer than I wanted, but it's definitely in the works. It will be happening, which we're excited about. The next question is, when a child is experiencing a negative behavior, is it safe to say to the child, would you like to talk about what's happening? So depending on the age of the child, so if it's a little bit, if it's like a 5-year-old, or what I would do with my 6-year-old is, if he's engaged in challenging behavior, absolutely. I might say something, I might say, do you want to talk about it? If he's crying and really upset, I would absolutely say, do you want to talk about it? But I wouldn't give him lots of other attention related to that. But yeah, for sure, especially maybe not in the moment, because, as we all know, when we're really upset and frustrated, it can be really hard to talk about our feelings. But especially as the child's calming down, absolutely, ask the child if they want to talk about it. I think it just depends on the age of the child, whether or not and you would be able to gauge that, whether or not, that's something that's reasonable given their language skills. But yeah, absolutely, that can be something you would do. That's the only question. Those are the only questions I see. I'm happy to answer more. Otherwise, I think that's it.
Wow, Erin, that was amazing. We're getting so many comments in the chat about how useful this information is going to be. I'm so glad that you guys have all come here. If you have more questions, please feel free to put them in the Q&A and we'll get to those. If you are joining by phone today, this is really important. If you're joining by phone today and you need child care training credit or CEUs, please send an email to the email box that's listed here on this slide, scic@mailbox.sc.edu, with your name, the session that you attended, and the phone number with which you attended the session, so that we can match you up for credit. I really, really would appreciate that. If you have questions or feedback, you can also use that same email box. We will be posting, handouts are already posted through the link that Nicole shared in the chat, but we will also be posting recordings of these sessions, and we'll send out a notification when those are up through the registration list, so you guys will have access to those. It may take us a minute. We're all learning how to do things, and so we're going to be learning how to start a YouTube channel and post videos up there. So that is where we are. I also have a little poll. I'm going to pop it up on the screen. This is our session evaluation. But if you have more questions, please feel free to continue to ask those, and Erin can respond to those.
Yeah, so it looks like there are 2 more questions, and for one of them, I'm going to actually go back to the first slide here. So The Barton Lab website is listed there at the bottom. And then there's a main page, but this here takes you right to the resources for caregivers, which is where all the infographics are. So that is that. And then the next question is, what are some strategies that can be used when children don't like sharing the computer and have challenged behaviors? I think, you know, a lot of the things I talked about regarding setting the expectations and providing reminders. So setting really clear expectations about computer use and how long you can be on the computer. And a great, you know, way to do this is to use other technologies to limit time. So you can even take it away, take it out of your control and just say, yeah, the computer, you know, this is how we use the computer. It can only be used, you know, for this application, this app, or this program. It can only be used for this amount of time. So just making sure that you provide really clear expectations, and then make sure that you tell the child, follow through, and give the child lots and lots and lots of positive attention for when they do follow the expectations. And then the next question says, repeat CEU information. So I put this up.
Yes, I'll get that. So if you are on the phone and you need credit, any kinds, you need to email your name, your phone number that you're joining us today, the title of this session, and one other thing. No, that's good. To our email account, which is scic@mailbox.sc.edu. And I'm typing it in the chat too, in case you have colleagues that can share the information with you.
So yeah, there's a question about children who've experienced trauma. And yeah, absolutely. I think especially the prevent strategies can be really helpful for children who've experienced trauma, neglect, making sure that you focus on the relationship, making sure that children feel safe and supported and loved in the environment is going to be really important. I would, you know, for children, depending on trauma, depending on their experiences, you might avoid some of the prompting strategies. You might avoid physical prompting. But absolutely, all of those prevent strategies that we talked about can be really helpful and important for children who've experienced trauma, neglect, maltreatment.
All right, guys, we're at 65% on our session evaluation. We can do better than that. They're still coming in. I have goals for all of you. I want 100% participation.
You can do it.
I do want to take this time to thank everyone that has been helping. I'm not sure if you guys know, but to make this session work, we have a presenter. We have someone who's been typing live closed captioning, which is wonderful. And we have myself and someone else co-hosting this session to make this all work. And I still think we had some glitches, but overall, I hope that it was a great experience for everyone. If you've completed the evaluation and you don't have any other questions, our time is up. I'm gonna stay in the session for a little bit longer because we're getting closer. We're at 74% with our evaluation. So I'm really excited to see those numbers, and I really appreciate everyone joining us this way. I've missed seeing you all in person. We'll hope that we can do this next year and we'll be able to be together.
Just one child interruption too. That's pretty good.
Yeah, and I didn't have a dog interruption. So, so I'll say that, you know, in these times, that's amazing.
Yeah.
It's also very real and makes your presentation even more relevant. Someone said most of the, I believe this one is certified in the curriculum area. So that was a question for child care training credit. It is certified for curriculum credit. You should have had a window that popped up for the evaluation. If you're using a device other than a computer, it might have popped up on a different screen. Okay, if you forgot to tell us that you needed credit, you can email scic@mailbox.sc.edu, and we can look into that for you. All right, it looks like we are at 100% for our evaluation. And thank you very much, Erin, for your time and all of this wonderful information. I can imagine that the metrics on your website are going to go sky high today with people checking that out.
Yay. We love that people are finding it useful, so that's great.
All right, thank you guys very much and have a wonderful rest of the day. I hope some of you are going to be attending breakout sessions that start at 11:30. Thank you.
Thank you.
Bye.